Freedom Wellness Center here. I'm Dr. Tory. Today we're going to talk about frozen shoulder. A lot of patients come into my office with frozen shoulder. I had a lady about a year ago that came in. Her shoulder was so frozen that she couldn't even put her thumb in her pocket. Forget about taking off her clothes, shirt, bra, all of that. She could not do it at all. Her whole shoulder was frozen and she was unable to move it. So we're going to talk a little bit about that today. The muscles in the rotator cuff are sits, supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles are controlled by the C5 nerve root coming out of the neck, and they come down through the brachial plexus and they control all of this. The purpose of the rotator cuff is to stabilize the external and internal rotation of that shoulder, and along with the motion of up and down and all those other motions in that area. What I have found in my practice, though, is that patients tend to show up in my clinic because they've tried everything else, all the trigger point injections and drugs, and they're facing surgery. And there's a research article out there that shows that when you have surgery on the shoulder, that the cranial nerves in your brain, cranial nerves 9, 10, and 12, are being affected. When we adjust C1, we're actually affecting cranial nerve 10, which is the vagus nerve. And when you couple the C1 adjustment with rotator cuff muscle manipulation, we find that the release of the rotator cuff is quick and effective. It took me about 6 weeks to get the lady who couldn't put her thumb in her pocket to almost complete full range of motion. It's been about a year now since we've seen her, and I saw her the other day and she still has complete range of motion. Frozen shoulder can be fixed without surgery, it can be fixed without drugs, it can be fixed pretty quickly and efficiently. This is Dr. Tory at Freedom Wellness Center talking to you about frozen shoulder.